The best advice that I can offer, honestly, be honest. Be open with your provider, about your use, your current opiate use, your past opioid use. Having a conversation about addiction, it's hard because you have guilt, there's shame, there's embarrassment, but you're human. And most opiates, they're very addictive. Numbers show that even 1 in 10 people who try opiates, they'll start to develop a dependence. And when this dependence goes unchecked and unmanaged, that's when we start to roll into things like opiate use disorders. So, most providers, we all care about your well being. We want you to live a healthy life. So, the more you actually know about the problem, the easier it'll be to actually treat the opiate use disorder and underlying causes. Because remember, OUD or opiate use disorder can actually be fatal, as we're starting to see in the news from all the fentanyl overdoses. So have that open and honest conversation, but also be prepared to ask your own questions. Great question. So, when it comes to honesty, to put it simply, the more we know about your opioid use, the better we can actually treat the condition and the person. So, you want to be as informed as possible, and we want to be as informed as possible about your treatment. So, when you actually go into a meeting with your provider, make sure that we understand your current drug of choice, right? Whatever that is that you're using. We want to know the amount per day that you're actually taking. How many times do you use it? Do you wake up as soon as you get up and use the medication, or do you fall asleep? And then also, what route the drug is actually being taken, IV versus taking it through the nose, or just inhale or ingesting it orally. Next, the provider needs a complete list of medications. Now, oftentimes, these lists can be sent in electronically once you sign your consent form. But it's a lot better for us to know it straight from you because some interactions can actually have, or some medications can actually have unfavorable interactions with Suboxone when you take them together. And that could be the Suboxone works better or the Suboxone actually works less in the body. Most prescriptions will be seen after signing your consent, so we'll know, but it's better that you just let us know so we can make sure there's something that might not be there that you're taking that didn't show up on the list. We also want to review your mental health history and, of course, your medical history. Your treatment provider, we're going to recommend different things, and those things and your needs are heavily influenced by your present condition and your past condition. So the more honesty you have with us and the more information you give to us, the better we can actually create a treatment plan for you and you alone. So here's a list of common things that you can ask your provider during your visit. First, make sure the provider is actually comfortable with treating opiate use disorder and prescribing Suboxone. It's usually best to have a specialist in opiate use disorders that does medication assisted treatment. But that question will have to be asked by yourself to that provider or from the actual treating group. Are we going to be using Suboxone or buprenorphine? We have this consensus that the mono product, which is buprenorphine, is not best used in our situation for addiction. But at the end of the day, that conversation has to be had between you and your provider to find out what's best for your situation. Another question you want to ask is how long is it going to take for me to actually feel better? That time is going to vary based on lots of things. Also ask how long will you actually need to be on Suboxone? This is a question that we have a lot of times, and we want you to get the answer from your provider because everybody's situation is going to be different, of course. And then also one of the biggest things, especially in the technology age, is your information confidential? We have certain safeguards in place for patient information, which you've probably heard of HIPAA. So ask the provider, ask about their group of how your information is actually protected. Having a clinician that understands the nuances and the dangers of addiction can help alleviate any undesirable outcome from treatment. Addiction medicine specialists understand the level of care needed for each specific treatment. They also will be able to build a treatment plan designed to match your current needs and lifestyle. Having a specialist also ensures that you have a successful sobriety so we can give you the right tools and the right information that are geared toward treatment of opiate use disorders because it is different treatment than treating someone for a cocaine addiction. Now, one size does not fit all, and we all know this. So the best thing is to partner with your provider and let them know all the things that you want out of your sobriety coming up. Now, some may need a higher level of care, which we will actually help you with those referral services. You might need inpatient treatment or outpatient treatment, depending on the severity of your use. There's certain medications that are not able to be prescribed through the telemedicine platform, and that's okay. No matter what, at the end of the day, we just want you to be safe. We want you to have the most appropriate treatment plan, and that's made specifically for you. The first risk is starting medication. The induction can be challenging based on whatever medication or whatever opioid you ended up using before you came to treatment. If your provider is not experienced with the induction, it can lead to precipitated withdrawals, prolonged withdrawal symptoms. It can lead to you actually not interpreting your own symptoms correctly and leading to some unfavorable outcomes. After patients detox off of Suboxone, sometimes they're very prone to wanting to stop the medication early, which might not be the best thing for you at that time.